But this problem of negative results that go missing in action is still very prevalent. In fact, it's so prevalent that it cuts to the core of evidence-based medicine. So this is a drug called reboxetine, and this is a drug that I myself have prescribed. It's an antidepressant. And I'm a very nerdy doctor, so I read all of the studies that I could on this drug. I read the one study that was published that showed that reboxetine was better than placebo, and I read the other 3 studies that were published that showed that reboxetine was just as good as any other antidepressant. And because this patient hadn't done well on those other antidepressants, I thought, well, reboxetine's just as good. It's one to try. But it turned out that I was misled. In fact, 7 trials were conducted comparing reboxetine against a dummy placebo sugar pill. 1 of them was positive, and that was published, but 6 of them were negative, and they were left unpublished. 3 trials were published comparing reboxetine against other antidepressants, in which reboxetine was just as good, and they were published, but 3 times as many patients' worth of data was collected, which showed that reboxetine was worse than those other treatments, and those trials were not published. I felt misled. They took all of the trials which were submitted to the FDA as part of the approval package, so that's not all of the trials that were ever conducted on these drugs, because we can never know if we have those, but it is the ones that were conducted in order to get the marketing authorization. And then they went to see if these trials had been published in the peer-reviewed academic literature, and this is what they found. It was pretty much a 50-50 split. Half of these trials were positive, half of them were negative, in reality. But when they went to look for these trials in the peer-reviewed academic literature, what they found was a very different picture. Only 3 of the negative trials were published, but all but 1 of the positive trials were published. Now, if we just flick back and forth between those 2, you can see what a staggering difference there was between reality and what doctors, patients, commissioners of health services, and academics were able to see in the peer-reviewed academic literature. We were misled. And this is a systematic flaw in the core of medicine. Publication bias affects every field of medicine. About half of all trials, on average, go missing in action, and we know that positive findings are around twice as likely to be published as negative findings. This is a cancer at the core of evidence-based medicine. If I flipped a coin 100 times, but then withheld the results from you from half of those tosses, I could make it look as if I had a coin that always came up heads. But that wouldn't mean that I had a 2-headed coin. That would mean that I was a chancer, and you were an idiot for letting me get away with it. But the effect on patients is damning. And this is happening right now, today.